Bismillahirrahmanirrahim. Assalamu alaikum. My name is Syed Farhad Ali and I am lecturer radiology at Professional College of Medical Sciences, Peshawar. And today's topic of our discussion is the gallbladder, the anatomy of the gallbladder, the parts of the gallbladder, and some function of the gallbladder. So the gallbladder is a pear-shaped sac-like structure. It is a pure and shape sac-like structure. And it is present to the undersurface of the right lobe of the liver. A gallbladder is an accessory organ of the gastrointestinal tract or gastrointestinal system, which is located within the right hypochondrial region of the abdomen. These are the 9 regions of the abdomen, and the gallbladder is present over here. And this place is the right hypochondrial region. Right hypochondrial region, and it is appearance sac-like structure. The gallbladder is about 7.5 to 12 centimeter in length, and it's about 2.5 to 3 centimeter in width, and about 1.1 to 2 nanometer in thickness. The thickness of the wall of the gallbladder is about 1 to 2 nanometer, and the gallbladder contain about 30 to 35 milliliter of bile, but this value is not fixed because it can expand up to 50 milliliter. So these are some of the length and width and the thickness and volume of the gallbladder. Now come towards the structure of the gallbladder. The gallbladder consists of about 4 parts. First is the fundus, the body, the infundibulum, and the neck. So these are the 4 main parts of the gallbladder. I'm going to draw the structure of the gallbladder. So the first part of the gallbladder is the fundus. And fundus is present at the level of 9 costal cartilage. This was the fundus. The medially to the fundus, body of the gallbladder is present. Body of the gallbladder, and next to the body of the gallbladder, the narrower portion, which we call it the infundibulum. Infundibulum. It is the narrower portion of the body that is continuous with the neck of the gallbladder. This is the neck of the gallbladder. GB mean gallbladder. Okay. Head, body, and infundibulum. But at the junction of, and this is the neck. And from here, the cystic duct start. So at the junction of the neck of the gallbladder, over here, and the cystic duct. There is an outpouching of the gallbladder wall known as Hartmann pouch. I'm talking about this area. And this is present at the junction of the neck of the gallbladder and the cystic duct. This place is known as Hartmann pouch. And it is the most common site of gallstones. Here, most of the gallstones are present. The Hartmann pouch. Now, we'll come towards the neck of the gallbladder. Neck connects to the cystic duct. This is the cystic duct, and this is the neck of the gallbladder. Okay, these are some of the parts of the gallbladder. These are the neck, the cystic duct, and here from this area the common hepatic duct come. Common hepatic duct. It meets with the cystic duct and goes down and form common bile duct. CBD means common bile duct, and the common bile duct goes down and enters to the first part of the small intestine, the duodenum. The duodenum. Here comes to the function of the gallbladder. So the gallbladder is the main site for the storage of the bile. Storage of bile. The liver as an organ which form the bile, and the gallbladder is an organ which store bile. Here bile is present. And cholecystokinin as in cholecystokinin stimulate the gallbladder to contract and release the bile into the cystic duct. CK, cholecystokinin. It stimulates the gallbladder. When the gallbladder stimulate, it contract, goes inward like this. During contraction, the gallbladder apply force on the bile which is present inside the gallbladder. The bile goes towards the neck of the gallbladder and then to the cystic duct. From the cystic duct, it goes down to the common bile duct, and from the common bile duct, it enters to the duodenum. Here, the food is present, and whenever the bile comes to the duodenum and it mixes with food, so it helps in digestion of food. Now come to the blood supply of the gallbladder. Arterial supply. So the cystic artery, which is a branch of the right hepatic artery, supplies to the gallbladder. Cystic artery is a branch of the right hepatic artery. As I told you in the previous lecture on liver, that cystic artery is a branch of the right hepatic artery, and it supplies oxygenated blood to the gallbladder. Venous supply. So the cystic vein drains directly into the portal vein, drain deoxygenated blood to the portal vein, and the portal vein then comes to the liver, and from the liver it enters to the inferior vena cava. Comes to the lymph drainage. So the lymph drains into a cystic lymph node. And the cystic lymph node is present or situated near the neck of the gallbladder, near the neck of the gallbladder. Nerve supply. So sympathetic and parasympathetic vagal fibers form the celiac plexus. And a plexus is the combination of nerves. So these all are about the gallbladder, its blood supply, venous drainage, lymphatic drainage, and arterial supply. These are about the gallbladder. And thank you so much for your precious time. Allah Hafiz.